Good morning. Thank you for this opportunity to speak at this important conference. It is an honor to be here with you today. This conference is a reminder of how critical it is to prevent tobacco product use, including e-cigarettes, among youth. Most tobacco use begins during adolescence or young adulthood and is the leading cause of many preventable diseases and deaths in the United States. With that, I want to thank you for being here. The dedication of each of you is what gives me hope that we can continue to help protect youth from the harms of tobacco products, including e-cigarettes. In December 2018, former U.S. Surgeon General Jerome Adams issued an advisory declaring e-cigarette use among youth an epidemic and urged action to protect young people from all tobacco products. I want to start by recognizing that there are many different kinds of commercial tobacco products. There are products that are combustible, like cigarettes, cigars, hookah, smokeless, and e-cigarettes, heated and dissolvable. The tobacco product and nicotine landscape changes and shifts, sometimes quite rapidly, with new things coming to market all the time. Nicotine exposure during adolescence can harm the developing brain. For young people, nicotine can impact the parts of the brain that control attention, learning, mood, and impulse control. It may also increase risk for future addiction to other drugs. Youth show signs of dependence quickly, sometimes before onset of regular or daily use. We also know that e-cigarette aerosol is not harmless. This aerosol that people breathe from the device and exhale can contain harmful and potentially harmful substances, including nicotine, heavy metals like lead, volatile organic compounds, and cancer-causing chemicals. Despite risks, youth continue to use these harmful products, particularly e-cigarettes. The National Youth Tobacco Survey, NYTS, is an annual cross-sectional, school-based, self-administered survey of U.S. students in grades 6 through 12. Since 2014, e-cigarettes have been the most commonly used tobacco product among youth. Over 2 million students, or 7.6% of America's middle school and high school students, reported current e-cigarette use. Among students who currently used e-cigarettes, the most commonly used device type was disposables. It's important to put the data on youth e-cigarette use in context. This graph shows reported past 30-day use of a variety of tobacco products among U.S. high school students. Among students, more than 13% reported current use of any tobacco product, and e-cigarettes were the most commonly used tobacco product overall. E-cigarette use among U.S. youth is driven by multiple factors, including advertising, flavors, and products with high levels of nicotine. E-cigarettes are marketed by promoting flavors and using a wide variety of media channels and approaches that have been used in the past for marketing conventional tobacco products to youth. Among middle and high school students, nearly 3 in 4 had ever observed e-cigarette-related content on social media. About 1 in 7 had ever posted pictures or videos of e-cigarette use, and about 1 in 4 had ever engaged with e-cigarette-related content on social media. More than 8 out of 10 middle and high school students who currently use e-cigarettes use a flavored product. The 5 most commonly used types of flavors include fruit, candy or dessert, sweets, mint, and menthol. Youth may start to use e-cigarettes or continue to use for a number of reasons. The most common reasons for trying an e-cigarette reported by U.S. middle and high school students who had ever used was because a friend used them, followed by curiosity. The connection to youth mental health is particularly concerning. Youth e-cigarette and cigarette use have been associated with mental health symptoms such as depression. Quitting smoking cigarettes is associated with lower anxiety, depression, and stress, as well as improved positive mood and quality of life. Scientists are still learning about the effects of quitting vaping on mental health. CDC provides funding to 50 states, the District of Columbia, 8 U.S. territories, and 26 tribal organizations. In collaboration with partners, we develop strategies and activities to prevent initiation of tobacco use among youth and young adults, promote quitting among adults and youth, eliminate exposure to secondhand smoke, identify and eliminate commercial tobacco product-related inequities and disparities. Over the past several decades, research led to many strategies which can reduce tobacco use. This includes establishing comprehensive clean indoor air policies that denormalize tobacco use and protect persons from exposure to secondhand smoke and e-cigarette aerosol. Advancing media campaigns that warn about the dangers of tobacco use, raising the price of tobacco products, and ensuring access to effective cessation treatments. We have seen these strategies be implemented in states across the nation. For example, Connecticut's Clean Indoor Air Act now prohibits smoking and vaping in workplaces of any size, and smoking rooms are not allowed. Last year, the California Tobacco Control Program ran 2 media campaigns, reaching 205 million people. The Flavors Hook Kids and We Are Not Profit campaign targeted parents and focused on the dangers of flavored tobacco, including the damage menthol-flavored tobacco has had on the African American communities in California. Additional strategies to protect youth in the retail environment include prohibiting the sales of flavored tobacco products, including e-cigarettes, implementing retail licensure for stores that sell tobacco products, and decreasing advertising and displays in stores. For example, in 2020, New Jersey, New York, and Rhode Island enacted bans on the sale of flavored e-cigarettes. And in 2022, Oregon retailers selling cigarettes, tobacco, and/or vaping products became required to obtain a license to sell these products. Washington County became the first county in Oregon to enact a full ban on all flavored tobacco and synthetic nicotine products, along with price promotions and discounts. Sustained implementation of population-based strategies, coupled with regulation of tobacco products by FDA, is critical to preventing and reducing all forms of tobacco product initiation and use among youth. FDA regulation of all tobacco products, including manufacturing, marketing, and sales, is a critical component of comprehensive approach to tobacco prevention and control. And recently, FDA has received authorization to regulate synthetic nicotine, which is increasingly being used in e-cigarettes. To protect youth, Hempstead Town and Nassau County in New York now prohibit the sale of vaping or e-cigarette products within 1,000 feet of a school, playground, or park. Tobacco cessation remains a challenge for youth. The evidence based on effective treatments for youth is slim, and more research is needed. This is challenged even further by the diverse and evolving product landscape. In the meantime, there are lots of promising practices and resources are available for youth who need help quitting. For example, state quitline service such as National Jewish Health's My Life, My Quit program provides quit support via a phone, text, and online chat. And Truth Initiative's This Is Quitting program provides text-based cessation support. National Cancer Institute provides online, text-based, and app-based cessation support through their Smoke-Free Teen effort. Before I close, I'd like to ask you to keep this conversation going. Prevention is critical in youth. You have the skills and resources to make a difference in these young lives. If you are a parent, talk with your child with clear, supportive, and action-oriented messages. If you are in the classroom or the counselor's office, have conversations with your students about tobacco use. Support those trying to quit, and don't give up on kids that are struggling. If you are in public health, partner with communities, health systems, and educators to raise awareness, move population-level approaches forward, and support communities at disproportionate risk. If you're in healthcare, talk to youth about tobacco use and offer treatment if needed, and follow up. Everyone has a role in addressing youth tobacco use, and we can work together to protect youth. Through years of data, research, and practice, we know what works. It is time to end the e-cigarette epidemic and prevent our youth from the harmful effects of tobacco use. Thank you.